Good morning. I upset you all yesterday. A lot of questions erupted from what I had to say, so I'm going to try to clarify some of this, maybe a little bit more clarity. I want to say, number one, thank Danny Vieira. He's done a beautiful job. He's a great friend, a good Christian. And I thank everybody that's helped us. It's made us an enjoyable event. And the audiovisual team has just done a fantastic job. It was just nice being around so many good Christian people. So with that, and I also like to say this is the most beautiful music I've ever heard in my life. I talked about how stress damages the brain, and that's been well demonstrated, but there's nothing to relieve stress more than beautiful music. So that's a great stress reliever. Today we're going to talk about preventing all of this damage I talked about yesterday. Dr. McDougall addressed some things that I thought were just really fantastic yesterday, but we have a major disagreement on the oils, so I'm going to try to shed a little light on the oil issue and maybe a few other things. Just a few questions have come up about the tofu. Just as a matter of review from what we talked about yesterday, I told you that free radicals seems to be the free radicals seem to be the central cause of most diseases that we can study very closely. And what we see is that the free radicals damage the cells itself, the different components of the cell. And this occurs over an entire lifetime, so that this constant chipping away at the stone, just like you see chipping away of stone by water, at the Middle Ages of life and beyond, that chipping away at that stone has been so extensive we begin to develop serious degenerative diseases. So the plan of action to help prevent this is to prevent as much of this free radical damage as early as possible. And that means if we start our diet very early with antioxidants to prevent some of this free radical damage, towards the middle ages of our life and the end of our lives, we'll be much healthier, and we can prevent many of these diseases. We know also that the brain begins to lose its energy supply, as does the rest of the body, because all these cells that are damaged by these free radicals, one of the primary effects, the cell loses its ability to create energy. Energy makes muscles move, they make the mind think, they make the impulses from the brain going to the muscles travel there. All of this is energy required. And without the energy, we begin to lose a lot of these capacity. If we look at boxers, for instance, if you see a boxer, when he's 30 years old, 35 years old, he begins to slow down considerably. His motor function, his skills, his coordination is significantly reduced at that point of his life. And that's very early to undergo those things. And it's because he's had tremendous damage to his brain from the blows to his head, and this produces a lot of free radicals in the brain. So what we're seeing in boxers is advanced aging. We know a lot of other things can cause advanced aging that we talked about yesterday: exposure to pesticides, exposure to excitotoxins in our food, advance the aging of the brain. High protein diets advance aging. Fluoride advances aging. In fact, fluoride advances aging so rapidly. One of the startling discoveries was they found this village in Europe in which everybody looked like they were 65 or older. They were all stooped over, they had arthritis, their skin was terribly wrinkled. And the reporter that came into this village said, why is everybody in the village elderly? Where are your young people? And then he started interviewing people, and he realized they were 30 and 40 years old. They had a lot of young people, but they looked like they were 65 years old, and this puzzled him. So they brought in some scientists, looked at the factors in the city, found out the water supply had a very high level of fluoride, sort of like what we get from brushing teeth and taking fluorinated water. And they found this produced rapid aging of the entire body. All the cells aged very rapidly. So fluoride is considered the aging mineral. Magnesium loss. We know that you lose a lot of magnesium as you get older. The American diet is very poor in magnesium. That leaves your heart vulnerable. It leaves your blood vessels vulnerable, and particularly your brain vulnerable. There's extensive literature in the peer-reviewed medical journals on cardiovascular disease that shows that magnesium deficiency rapidly advances arteriosclerosis, rapidly advances coronary heart disease and stroke. There's also an even more extensive medical literature that shows that when the magnesium level in the brain is low, you have a much greater injury to the brain with strokes, with brain trauma, with any kind of injury to the brain. If the magnesium is low, that injury is greatly, greatly magnified. Because of all of these changes of degeneration, the blood supply to the brain decreases because of arteriosclerosis, and that has a lot to do as to how you're going to function later in life and your risk of having a stroke. Now, not all strokes are evident. We have what we call mini strokes or silent strokes. And this is when little small blood vessels in the brain begin to close off, and these little areas of the brain begin to die, but it's so subtle you don't notice it at first. As they begin to accumulate, you start having trouble with memory, you start having trouble with orientation, you start having trouble with movement, and it just slowly, slowly builds up as more and more of these blood vessels shut off. That's a very common condition. It's called multiple infarct dementia. This can be prevented mostly by diet, and it's mostly caused by a poor diet. We know as you get older, your antioxidant defenses begin to decrease. They slowly become less and less because of a poor American diet. And one of the primary things we're seeing in American society today is a depression in immunity. Some of the people were asking Dr. McDougall yesterday about Candida infections. Well, we know that usually when people have repeated yeast infections, it's because of poor immunity. Overuse of antibiotics, it suppresses the immunity. So we're seeing in the general population a depression of immunity and a lot of diseases that are resulting from that. One of the things we're seeing that's not really discussed very much is chronic infections. We see smoldering infections from viruses, mycoplasma, all sorts of organisms that go on for decades or a lifetime. When you have these smoldering infections, your immune system is trying to get rid of it, but it's weakened, it can't get rid of it, and as a result, you're producing enormous free radicals in an effort to rid yourself of these organisms. We see that with rheumatoid arthritis. There's good evidence that it's caused by a mycoplasma infection. Even some of the brain diseases, chronic brain diseases, may be related to chronic infections. Now, to see what we can do to help prevent this, number one, of course, is to improve the diet and the intake of antioxidants. And one of the premier researchers in the area of free radicals and antioxidants, Dr. Lester Packer here from California, has worked out what he calls the antioxidant network. And these are the basic antioxidants that do most of the work in protecting the cells against all of this damage that we talked about yesterday. We see that ones that most of us are familiar with, vitamin C and vitamin E at the top of the list, these are very important. Vitamin C, also known as ascorbate or ascorbic acid, is ubiquitous in plant life. You see it in most plants. And that's because it also protects plants against free radicals. You have to realize plants are subject to free radical generation as well. And the ascorbate is the buffered form of vitamin C. You should not take ascorbic acid as a supplement because ascorbic acid will make your blood acid. That will help decalcify your bones. It will produce all sorts of things. Viral eruptions will occur, and a lot of people develop ulcerations of their mouth taking ascorbic acid because it activates the virus. When you take the buffered form, it's highly absorbed, it's distributed in the brain, and it's very safe. It buffers your blood and it strengthens the bones. Vitamin E, the tocopherols we'll talk about a little bit more in detail, but it's a very powerful antioxidant. But it exists mainly in the fatty parts of the cell. It protects all the fatty parts of your cell. It protects the cholesterol from oxidation. Coenzyme Q10 is one of the primary energy generators inside that little part of the cell I told you about yesterday, the mitochondrion. It's a very, very important energy molecule. It also is a very powerful antioxidant and does a lot of other interesting things to protect the brain and the rest of the body. Alpha-lipoic acid is an antioxidant found in all living tissue. It's everywhere in the body, in the plasma, in the extracellular tissue. It's in all of the cells, contains alpha-lipoic acid. It is one of the most powerful and versatile antioxidants in the biological system. Very, very important. Glutathione, that's the antioxidant I told you about yesterday that exists in every cell in the body. The levels of glutathione correlate directly with almost all diseases. As we get older, our glutathione levels begin to decrease. As the glutathione decreases, cancer rate goes up. As glutathione decreases, neurological diseases go up. That includes Alzheimer's disease, Parkinson's disease, all of these diseases. And one of the things we learned about Parkinson's disease is that about a decade or more before you develop any symptoms whatsoever, the glutathione level begins to decrease in that part of the brain that causes Parkinson's disease. That is the first event that is seen to occur. Then after that, you begin to develop iron accumulation in that part of the brain. And as we said yesterday, iron is a very, very powerful free radical generator. So the antioxidants are decreased in that part of the brain, the glutathione is decreased, and it destroys the cells in that part of the brain. Finally, one that's overlooked a lot in discussions about antioxidants to the general public, and that is the power of flavonoids in plants. Now, flavonoids in fruits and vegetables, these are very complex chemicals. They're so complex, the pharmaceutical industry has been spending millions and millions of dollars trying to duplicate them, but they can't. God made them so complex, the pharmaceutical geniuses cannot replace them. Now, the flavonoids, there's about 5,000 of them have been identified in plants. They have some tremendous and almost miraculous functions. In cancer, we know that as cancer develops in a cell, it changes the DNA, turns on a cancer gene we call an oncogene. Then it goes through a whole series of enzymatic changes in that cancer cell that makes it different from a normal cell. Well, what we've discovered is that flavonoids of different kind can interfere with the cancer process all the way from turning on that cancer gene through all those enzymes the cancer cell depends on. And that's why when Dr. Day talks about preventing and curing cancer with plants, this is how it works. The flavonoids powerfully inhibit the cancer process, and they powerfully stimulate the immune system. They are enormously powerful antioxidants. I've written a couple of papers for scientific journals trying to get the scientific community interested in the use of these flavonoids to prevent neurological disease, because no one's looking at that right now. But they're more powerful than the vitamins. Vitamin C and vitamin E are very powerful antioxidants. Flavonoids are much more powerful. When they're combined with vitamin C and E, they have even greater capacity to prevent these diseases. Now, glutathione is something that we need to spend a little bit of time with because, as I said, it exists in every cell in your body. It is absolutely essential for life. Without it, you die very quickly. Without it, you'll develop, or if its levels are low, you'll develop a multitude of degenerative diseases, all the way from diabetes, hypertension, you'll develop arteriosclerosis, all these diseases associated with low glutathione levels. And we find that as you improve the glutathione levels, these diseases improve dramatically. It is the most abundant antioxidant in cells. When you fast, that is when you do without food, you can reduce the amount of glutathione dramatically, 20 to 50%. Now, this is prolonged fasting, not fasting for a day or so. There are several ways to increase the amount of glutathione in your body. There's a substance called N-acetyl-L-cysteine, or frequently goes by the initials NAC. You hear people in health food stores talk about NAC. Well, that's N-acetyl-L-cysteine. Cysteine by itself is toxic to the body in high concentration, so you don't want to take cysteine by itself. N-acetyl-L-cysteine is designed so that it only releases the cysteine inside of the cell where it's safe, and it's been found to significantly elevate glutathione levels. They tested it on Parkinson's patients and found that 42% of Parkinson's patients showed a dramatic improvement when they took NAC, this N-acetyl-L-cysteine, because it increased the glutathione protection of the brain. Alpha-lipoic acid is also very protective of the glutathione in the cell, so that if you take supplements containing alpha-lipoic acid, the glutathione level increases significantly. Vitamin C, the ascorbate, also increases glutathione in the cell and protects the glutathione. Interestingly, a lot of these very powerful antioxidants like alpha-lipoic acid and glutathione, if you increase their level, it's almost impossible to produce scurvy. You know, if you become vitamin C deficient, you develop this syndrome of scurvy, the bleeding gums and fragile blood vessels, and eventually you can die from scurvy, lack of vitamin C. But they found that a couple of things can happen. If you feed a person a lot of flavonoids or alpha-lipoic acid or glutathione, it's almost impossible to produce scurvy. It's almost impossible to produce vitamin E deficiency if you use those powerful antioxidants. And that's because it protects what vitamin C and vitamin E is in the body, and it won't become depleted. We've also found that if you lower the magnesium in the body, the glutathione levels fall very low. You remember yesterday I told you that if your magnesium is low, it doubles the amount of free radicals that are being formed, and it increases the toxicity of those free radicals by a factor of 2. So it's important to keep the magnesium levels elevated. Now, you cannot measure magnesium in the blood. If you go to your doctor and you say, well, I heard this lecture how important magnesium is and I want to have a magnesium check, and they'll draw your blood and run the magnesium, it is not a good way to tell how much magnesium is in your blood. What we found is that you can have a perfectly normal blood magnesium level and your tissues can be extremely deficient. And that's because magnesium is found mainly in tissues, not in the plasma, not in the blood. And so that's not a good way. You have to either examine the red blood cells for their magnesium level, or a hair analysis can tell you how much magnesium you have. So magnesium is extremely important. We'll go through that a little bit more. Now, this was a very brilliant idea that someone had. We know that science likes to dissect things. If they find out that cancer rates are low when people eat citrus fruits, they look for the one factor in the citrus fruit that lowers cancer rates. And so they took out the vitamin C and they fed it to people, and it seemed to affect the cancer rate of some cancers, but a lot of them it didn't seem to help at all, and some of them it actually increased cancer rates. They did the same thing with beta-carotene. They said, well, this fruit contains a lot of beta-carotene. That must be what's preventing the cancer. So they took out the beta-carotene and they gave it to people, and it did reduce a lot of cancer. Beta-carotene will reduce the incidence of most cancers and some very dramatically. Only if you are a heavy drinker and smoker, 3 or 4 packs a day, and do everything else bad for your diet, does beta-carotene increase your lung cancer rate. It did not do it in everyone else. So if you're not a heavy drinker and a smoker, you're not at risk of beta-carotene increasing your cancer rate. But the problem with science doing it that way is that these things work together. Beta-carotene doesn't work alone. There are over 40 carotenoids in plants and in our diet. All of them have functions. All of them work in different parts of the body. All of them work in different parts of the cell. You have to have all of them. For instance, lutein is a carotenoid that's very high in spinach and bilberries and blueberries. Lutein, zeaxanthin, 2 of these type of carotenoids are very high in the eye. They're very important for protecting the eye. And people that have very low lutein levels have a high incidence of macular degeneration. Those with real high levels have very low incidence, and you can even reverse some cases with high intake. So what someone did is they said, okay, apparently it's not one factor in these fruits and vegetables that's doing all these wonderful things. It's a combination of them. So let's take a whole fruit and examine its power to inhibit oxidation and see what that does. And so they worked out this thing called the ORAC unit, which is the oxygen radical absorbency capacity. That's hard to say 3 times in a row. And what they did is they listed fruits and vegetables, about 100 of them, according to their power to inhibit these free radicals. And they found some rather surprising things. Top of the list was prunes. It was the most powerful antioxidant fruit and vegetable they could find. Second was raisins, then blueberries and blackberries, garlic, kale, cranberries, and raw spinach. All of these are the top of the list of the antioxidant fruits and vegetables. It pretty much follows what we found were the most powerful fruits and vegetables to inhibit cancer, what we call the cruciferous vegetables, and the fruits that we knew that were associated with very low incidences of cancer. And it's because these plants contain hundreds and thousands of complex chemicals in addition to the vitamins that are inhibiting cancer and inhibiting degenerative disease and probably inhibiting brain diseases as well. So the ORAC unit has become a very useful but a brand new measure. Most people are not aware of that. Another way to improve brain function we found that surprises some people is exercise. We found that exercise doesn't just make you feel better, but it improves the connections in the brain. So all these little connections we have, the synapses and the fibers that are constantly growing in your brain even up to age 100, are improved when you exercise moderately, and I emphasize moderately. We know that exercise increases blood flow to the brain so the blood flows better. We know there's less arteriosclerosis in the blood vessels to the brain when you exercise moderately and have a good antioxidant defense system on top of it. When they looked at elderly people who exercised regularly, they found they had better cognitive function. They could think better. Their minds were clearer. And we find that when you exercise moderately, it improves your immune system. You're less likely to get cancer. We find that when you exercise moderately, it increases your antioxidant defenses. It stimulates antioxidant enzymes that are in your body. Now, extreme exercise can have the opposite effect. We know that when you extreme exercise, you produce enormous numbers of free radicals in your brain. And we also know that people who are extreme exercisers seem to have a higher heart attack rate, arteriosclerosis rate, stroke rate, and possibly cancer rate and neurodegenerative disease rate. So extreme exercise is not a good thing to do. When you exercise, you have to significantly increase your antioxidant intake, these ORAC units, okay? Vitamins, flavonoids, all the fruits and vegetables have to be increased because that's your antioxidant defense against free radicals. Now, one idea that came up, that made a lot of sense. My dad used to say the brain's a muscle. If you don't exercise, it'll atrophy. And he was right. And it turns out when they got to looking at whether or not using your brain a lot makes it work better and last longer, they found out, well, it does do a lot like a muscle. If you don't exercise it, it begins to atrophy and die. Now, they studied a large number of nuns. And the reason they picked nuns is because they lived together, they ate the same thing, so they had pretty much the same lifestyle. But what varied is some of them were very intellectual and some were not. And they found those that engaged in intellectual pursuits the most, kept their mind up, reading and learning and constantly, suffered significantly less from Alzheimer's disease than those who didn't, even though their diets were the same. A Chinese study looked at it and found that the less educated Chinese had a 4-fold higher incidence of dementia than the better educated. Now, that might be dietary, because I'm sure that the less educated Chinese didn't eat as well. But the nun study does seem to indicate the idea, use it or lose it. Now, we had some discussions about fat yesterday, and unfortunately, I don't agree with some of this. What matters is the type of fat. All fat's not created equal, and I emphasized that yesterday, the bad fats and the good fats. But fats aren't created equal. Some are very bad for you, some are extremely healthy. Saturated fat, which is animal fat mostly, seems to be somewhat bad for you, associated with a lot of disease if you're consuming a lot of saturated fat. They found that if they took lab animals and fed them a diet that was high in saturated fat, they had poor short-term memory and long-term memory. That is, being able to remember a long time ago plus what you're learning today. So it significantly impaired their ability to learn. It was associated in human studies and in animal studies with increased degenerative brain diseases. Makes the brain degenerate faster. And a surprising study at Columbia University, which is not so surprising, really, they found that people over age 65 who ate the most animal fats were 5 times more likely to develop Parkinson's disease. Now, whether that's directly due to the fat or the fact that fat absorbs pesticides, so that when these animals are out in the field, they're absorbing a lot of pesticides. They're sprayed in the fields and sprayed on crops that might be nearby. So there's a lot of pesticides in animal fat. So when you're consuming the fat, you're consuming the pesticides as well. Well, let's take a look at polyunsaturated fats. What that means, if a fat is saturated, that means all the double bonds have been replaced with fully saturated single bonds. It has all the hydrogen in it. So it's not very easy to oxidize a saturated fat. A polyunsaturated fat means it has a lot of double bonds. It doesn't have enough hydrogen in it. And it's very easy to oxidize polyunsaturated fats. When they looked at polyunsaturated fats and see the effect on elderly people, and these are all human studies, the Zutphen study, which was in Scandinavia, elderly study, a very large study, over 10,000 people, they found that those who ate the most of the omega-6 type fats, that's the corn oil, peanut oil, safflower oil, sunflower oil, canola oil, when they ate the most of those oils, they were 75% more likely to have cognitive impairment. It means difficulty thinking. Another study in which they again looked at the consumption of these omega-6 fats found that it increased 250% mental impairment in those who were eating that high intake of the omega-6 fats. And unfortunately in this country, almost all the fats in processed foods are omega-6 fats. We have very, very little omega-3 fats in the food. It was also found that those who ate fish, omega-3 fats, an extra ounce once a week cut the risk of cognitive decline by 55%. So the type of fat makes a lot of difference. And we'll find that subdivisions of that type fat makes a difference. Now, we also had one of my favorite oils attacked yesterday, extra virgin olive oil. Extra virgin olive oil is an extremely healthy oil. Okay? It's healthy not just because it has an anticoagulant potential. That is, it thins the blood slightly, not enough to make you hemorrhage. You won't bleed to death drinking olive oil. It won't interfere with your surgery. You can have surgery and you can eat olive oil. It's not a contraindication to these things. But olive oil, if it is extra virgin, which means it retains all of the flavonoids in the oil, has been shown to dramatically reduce heart attack, stroke, arteriosclerosis, but surprisingly or not surprisingly, it also significantly reduces brain degeneration. When they looked at elderly Southern Italians who ate the most of olive oil, they found that those who ate olive oil regularly cut their memory loss by 1/3. Olive oil seems to preserve the ability of the brain to think clearly. And the amount they were taking in was about 3 teaspoons a day. Now, the obesity with olive oil, if you look at the people, the pictures that he was taking, the way they consume the olive oil is they dip bread in it. They eat enormous amounts of bread. They eat a lot of other things that increase their fat accumulation, not from the extra virgin olive oil. Extra virgin olive oil does not become rancid. You can cook in it. It's an extremely stable oil because it's monounsaturated. The flavonoids in the oil also protect the oil while it's sitting out, unlike the other polyunsaturated oils. Now let's look at a special type of omega-3 fatty acid. When you consume an omega-3 fatty acid like flaxseed or some of the other omega-3 fatty acids, what we call alpha-linolenic acid, your body converts it into 2 different fatty acid components, one called EPA and the other DHA. These have very powerful health-promoting capacity. The DHA particularly, it does most of the good things we associate with omega-3 fatty acids, particularly in the brain. DHA makes up 50% of the brain fats. Your brain has 60% polyunsaturated fats in it. Half of those are DHA. Very important for brain function, brain growth, and maintenance of the brain. We know that DHA is a powerful anti-inflammatory, and we said yesterday that most of the degenerative brain diseases are inflammatory diseases. So it's very important that this type of oil significantly reduces inflammation of all organs in the body and all tissues in the body, but particularly the brain. We know that DHA increases serotonin levels in the brain. Serotonin is a neurotransmitter. It's associated with sleep. It's associated with preventing depression. It's a mood elevator. But it does not increase serotonin levels in the brain pathologically. It just restores them to normal. We know that there are very high concentrations of DHA oil in the synapses of the brain. These are the connections between the different cells. And this is what changes all your life. I don't care if you're 75 years old, 80 years old, 90 years old. You're always forming new pathways in your brain. You're always forming new synapses. That's what keeps the brain healthy. It is very dependent on DHA oil. If you go on a stringent, oil-restricted diet, you are interfering with its capacity to develop these synapses. We know that this oil increases acetylcholine levels in the brain, which is a neurotransmitter. It's decreased in Alzheimer's disease, so you want it back to normal levels, and that's what DHA type oils do. One problem we find with flaxseed is that infants cannot convert flaxseed to the DHA oil. Adults have trouble converting flaxseed to DHA oils. And that's because it has to be converted by an enzyme called delta-6 desaturase. That enzyme has a competition going between omega-6 oils and omega-3 oils. If you're consuming a lot of omega-6 oils, it cannot convert. It uses up the enzyme. As you begin to age, you decrease the amount of that enzyme, so you can't convert flaxseed oil to DHA. Now, I do fatty analysis on some of my patients, and I have given some of them flaxseed oil and shows that they do not convert, and they still have very low DHA levels. So, and a fair number of people are unable to convert it. Now, if you're going to eat flaxseed and retain DHA, you'd have to eat about 10 to 40 grams of flaxseed oil to produce 200 milligrams of DHA, which is a low level of DHA. We find also that DHA seems to help Alzheimer's patients. In one study of 100 Alzheimer's patients found 81% of them improved in their mood, their sleep, their memory, and their orientation after being placed on DHA oils. Another interesting experiment they did, this was on some university students, they found if they increased their intake of fish oils or DHA, which is a plant-derived oil you can get from algae, if they increased their DHA levels, it reduced their stress-induced aggression. So they were less aggressive when they were under stress. Did not reduce aggression if you're not under stress. In other words, if you're just a mean, nasty person, it may not help. Over the last 40 years, the amount of DHA we consume has been reduced to about 50%. So we're consuming a lot less of it than normal. Now, yesterday, Dr. McDougall said, well, you get omega-3 fatty acids in plants. You do, but they're very, very low concentrations. The brain requires very high concentrations of DHA oil. A study done of Alzheimer's patients demonstrated that they were 2.5 times more likely to have low blood levels of DHA than normal people. And when they looked at the elderly with low DHA levels, they were 67% more likely to develop Alzheimer's disease within 10 years of the study. So we see that it is closely related to developing Alzheimer's disease and other neurological diseases. How much DHA should you have? Generally, anywhere from 400 to 600 milligrams of DHA a day. You can buy DHA in a health food store. It should be kept in the refrigerator, and it usually comes in 200 milligram capsules. It's extracted from algae. That's where fish get their omega-3 fatty acids because they eat the algae. Now, you see a lot of advertisements on television telling people to drink their Ensure, and they have all the happy elderly people on TV telling how much better they feel. Well, I looked up the ingredients on Ensure, and it contains corn syrup, maltodextrin, sugar, high oleic, safflower oil, canola oil, soy protein isolate, whey protein concentrate, corn oil, carrageenan, ferrous sulfate, and alpha-tocopherol acetate. This includes this mixture 3 excitotoxins, immune-suppressing oils, free radical-promoting iron, pro-carcinogen carrageenan, excess sugar, and a useless form of vitamin E. So it's really not that healthy. A lot of surprises out there. Now let's look at some of the supplements we know that improve brain function. And these are being used in some serious brain diseases. And they're finding that people improve significantly when they receive these. Coenzyme Q10 is an enzyme that the cell uses to produce all that energy I talked about. It is absolutely critical. If coenzyme Q10 levels fall, you cannot produce the energy. Thiamine, riboflavin, niacinamide, these are the B vitamins that are very important in brain function. Pyridoxine could also be added to this list as vitamin B6. All of these are very important for any nervous system function. We find as we grow older, these vitamins are decreased. Vitamin K actually increases energy production in the brain, is very important to prevent osteoporosis. Acetyl-L-carnitine is an energy molecule used by the cells to metabolize fat and also to produce energy and doing a lot of other miraculous things. Ginkgo biloba is an herb that is just one hair short of a miracle. It is very safe in most instances. It produces a lot of health benefits. Improved energy of the brain is one of them. And alpha-lipoic acid improves glucose utilization by the brain. So all of these things dramatically improve energy production and health of the brain. I'm going to go through some of them just to give you an idea of what they do. Alpha-lipoic acid is kind of the central antioxidant in the body. It's everywhere. It does everything. It is a very powerful free radical scavenger, as we talked about. It binds different types of heavy metals. We know that heavy metals like arsenic, cadmium, mercury, all of these things are very toxic to the brain cells as well as other cells. And you want to get rid of them. You want to get them out of your body. Chelation means that whatever you chelate with binds with the metal and removes it from the body. And they found that alpha-lipoic acid is a very good chelator of arsenic, cadmium, and mercury. So it's a good way to reduce it. You can treat mercury poisoning with alpha-lipoic acid. A form of alpha-lipoic acid called dihydrolipoic acid also is an antioxidant, and it will restore the other vitamins, vitamin C and vitamin E. It increases cellular coenzyme Q10 levels. It increases glucose transport into the brain. It blocks excitotoxicity by 50%. And it is a very powerful radioprotectant. That means it protects you against radiation. You know, when the Chernobyl nuclear power plant exploded in the Soviet Union and exposed all those people to very high levels of radiation, particularly the children. And so the Americans went over there to carry out an experiment, see what they could do to help the children. Well, you can measure radiation damage by a special substance that builds up in the blood called a clastogenic factor. All these children had very high clastogenic factors, including the adults. They gave them vitamin E, it lowered it very little. And then they tried alpha-lipoic acid, and their clastogenic factors fell to 0. When they gave them vitamin E plus alpha-lipoic acid, it was totally normal. So it is very powerful protectant against radiation damage. Ginkgo biloba, obtained from the ginkgo tree, the oldest tree in the world. This plant contains numerous antioxidants. It contains numerous anti-inflammatory molecules. It increases blood flow through the heart, through the brain. It reduces cardiac arrhythmias, that is abnormal beating of the heart. It reduces heart attacks and stroke incidence significantly. When they tested on Alzheimer's patients, it improved their memory and daily function 30 to 40%. It increased the brain energy production significantly. It reduces coagulation of the blood, and this is where you'll see the pharmaceutical companies getting the journals to put out scary articles for the public that you'll bleed to death if you take ginkgo biloba. And then they'll turn around and tell you to take aspirin every day. Ginkgo biloba does not anticoagulate you any more than that aspirin does. And that's why it helps protect you against heart attack and stroke, but that's only part of the reason. It's an antioxidant, very powerful. Now I'm going to talk about something, acetyl-L-carnitine, which is also a supplement you can get in health food stores, non-prescription. You can get it as a prescription if you want to pay 10 times more than usual. The acetyl-L-carnitine, it does so many things, it took me 2 slides to list them all. It is a powerful antioxidant. It increases the ability of your cells to produce energy. It stabilizes membranes of cells. One of the problems with cells and all that free radical damage is the cell membrane becomes unstable. It loses its fluid quality, becomes too stiff. And we find the acetyl-L-carnitine returns the cell back to the appearance of a young cell. They call it the anti-aging brain supplement. The research scientists do. And most of them take it. They don't tell you they do, but they do. I know some of the people that are doing some of the primary research in acetyl-L-carnitine, and they take it every day. It increases acetylcholine transmission in the brain, which has to do with memory. It chelates iron. You remember we said you accumulate iron in your brain as you grow older. This helps get rid of that excess iron. It reduces the loss of brain cells in the prefrontal lobe and hippocampus. The hippocampus is what's mainly damaged in Alzheimer's disease. It reduces an age pigment called lipofuscin, and it reduces the loss of receptors in the brain. And that's what happens when you get older. You start losing your receptors, so the cells can't communicate to one another. And it restores these receptors to the population that you see in younger people. Increases learning and memory, increases brain levels of coenzyme Q10, increases brain levels of glutathione, increases GABA, which is a neuromodulator which helps prevent brain destruction by excitotoxins. And we know that MSG interferes with the brain's uptake of acetyl-L-carnitine, another reason to avoid MSG. Vitamin C, I just want you to know that it's more than an antioxidant. Vitamin C is very important for the brain. We all know that it improves collagen synthesis, that it strengthens ligaments, muscles, bone. If you have osteoporosis, you need vitamin C to strengthen the bone matrix. It's a powerful antioxidant. It has immune function. It'll stimulate the immune system. It causes the brain to secrete more acetylcholine and dopamine related to memory, dopamine associated with Parkinson's disease. It controls the brain glutamate system so that your brain won't secrete too much glutamate. It regenerates vitamin E. So vitamin C is very important for the brain. Vitamin E, there's a lot of confusion about E. E is made of 8 different components. There's not just one type of vitamin E. There are 4 tocopherols and 4 tocotrienols. The tocotrienols are being found to be enormously preventive of cancer and very effective in treating breast cancer. They also recently shown that tocotrienols can actually reverse arteriosclerosis. Vitamin E is a powerful immune stimulant, very necessary for immune function. As we get older and get decreased vitamin E levels, our immune system begins to fail. We know that as we get older, the immune system begins to decrease significantly. But it's nutritional. If we take elderly people and we give them carotenoids, we give them vitamin E, vitamin C, it restores their immune system back to the status it was when they were 20 years old. We know that vitamin E is very important in preventing cholesterol from oxidizing. One of the things that most people aren't told that is very well known and very well demonstrated now is that cholesterol, no matter what level it is, does not cause arteriosclerosis unless it oxidizes. LDL cholesterol oxidizes a lot easier than HDL cholesterol. That's why it's associated with a higher instance of heart attack and stroke. Vitamin E is incorporated into LDL cholesterol to prevent it from oxidizing. When you become deficient in vitamin E, it leaches out the vitamin E out of the LDL, or the vitamin E actually becomes oxidized, and that's why you end up with arteriosclerosis. So it is a powerful antioxidant. The flavonoids in plants also prevent LDL from oxidizing. Vitamin E regulates cell reproduction and is a powerful cancer inhibitor. It is an anti-inflammatory. It improves blood flow. Vitamin E is very important, but not all vitamin E is created equal. When you go to Walmart, you go to places where they have discount vitamins, you'll see something that's called D-alpha tocopherol acetate. It is worthless. In studies on cancer, it has no effect on the cancer. In studies on the brain, there's evidence it doesn't even enter the brain. Most of the research that has been done on vitamin E and brain was done with the acetate form. Most of the research that was originally done, and a lot of it is still being done on vitamin E, in which they say it seems to not prevent cancer, they're using the acetate form. It is well demonstrated that only 2 forms of vitamin E prevent cancer and prevent cancer from growing. That is the natural form of vitamin E found in plants, and a form called vitamin E succinate, which is the most powerful form of vitamin E. Succinate is a normal component in the body. So vitamin E succinate is the most powerful antioxidant form, and it is the most powerful cancer-inhibiting form of vitamin E. They rarely use it in these studies. Surprise. Functions of coenzyme Q10, we said it does a lot of these same things. It's a powerful antioxidant, restores the other antioxidant, protects against excitotoxicity, increases cell glutathione levels. There's experiments that have shown that excitotoxins destroy the part of the brain that produces Parkinson's disease. So now most neuroscientists agree that excitotoxins play a major role in Parkinson's disease. Well, one researcher found that if you took coenzyme Q10 and linked it up with niacinamide, the form of niacin that the body uses, and used that combination, you could prevent excitotoxins from destroying these cells that cause Parkinson's disease. They're now getting ready to start doing some studies to see if the combination of coenzyme Q10 and niacinamide can prevent and treat Parkinson's disease. I'm already using it. I didn't wait on them. It improves all other brain functions as well as all cell function. All cells use coenzyme Q10. Take a peek at flavonoids. Flavonoids are that 5,000 complex chemicals I told you about that the pharmaceutical industry is pulling its hair out trying to figure out how to steal them and patent them so they can make millions off of them. God put them everywhere. In this task, this is a recent task, appeared in the Journal of Neuroscience, which is the most prestigious neuroscience journal we have. They did a study in which they tested blueberries, strawberries, and spinach extracts on aged rats to see the effect on learning and memory. They found that this combination was enormously protective of the brain. Blueberries seemed to lead all the others. And I just listed some of the things that probably won't mean a lot to you. But these are the things that are associated with brain dysfunction with aging, and it corrected them. So high intake of blueberries, strawberries, and spinach seems to be enormously protective of the brain, particularly your ability to think in complex ways and remember. And the hippocampus of the brain, which is the part that does the recent memory, as well as many other things, vitamin E was very protective, particularly when combined with these flavonoids. There's a lot of other things out on the market that seem to significantly enhance brain function. The first one is glyceryl phosphorylcholine, which is just a form of choline that's highly absorbable. Phosphatidylserine seems to protect the brain, has improved Alzheimer's patients. Panthenine, which is pantothenic acid, vitamin B5, which is the form your body uses, is very protective of the brain. Vinpocetine is a natural substance that also does some pretty miraculous things, pregnenolone and DHEA. This first substance was interesting because it's found in breast milk. It increases the brain's choline level, which makes acetylcholine, which is what's considered the memory molecule. It plays a role in your ability to sleep soundly. And they found that if they feed this to pregnant animals, it improves the offspring's memory for the rest of the offspring's life. Makes up most of the brain's membranes and improves memory function in dementia. Phosphatidylserine you can buy at health food stores. It's very expensive. There were two forms. One was made from animal brains. That became very unpopular with the mad cow disease, so now they make it from a plant extract. It has been shown to significantly improve memory, particularly in elderly people. Restores the useful fluid quality of the cell membrane. You know, as you get older, your cell membranes get stiffer and less functional. It'll return it back to 20-year-old cell membranes. It improves the transmission of impulses in the brain, increases the receptors that are lost with aging and degenerative diseases, more alert, greater mental clarity, greater energy, and it reduces stress-related injury to the brain. We know you said stress is very damaging to the brain. Vinpocetine is a new arrival on the market. It's been used in Europe longer. It's been found in experimental studies to improve blood flow to the brain, increases the amount of glucose that can get into the brain. We said that's the brain's only fuel. It protects against excitotoxicity, lowers brain inflammation, which is important because inflammation of the brain is what causes all these degenerative diseases. It improves blood flow to the inner ear if you have inner ear problems, and it's been shown to prevent macular degeneration. Pregnenolone is a precursor of hormones in the body. We found that the brain uses a lot of pregnenolone. It has receptors for pregnenolone and DHEA, which is a precursor of the male and female hormones. And the brain contains 10 times more pregnenolone receptors than it does DHEA receptors. Depressed people have 50% lower levels than do non-depressed people. When it was given to people, they found it increased mental clarity, energy, and protect them against stress-related brain injury. Now, pregnenolone and DHEA are both hormones, and they should only be used under a competent physician's supervision. By competent, I mean somebody that knows something about it. Because a lot of physicians, if you say pregnenolone, they're going to look at you like you're crazy. And they'll go to their PDR and they can't find it. So it has to be someone who deals with this and knows about these hormones, because they can have contraindications. The developing brain. This is one of the areas that I'm kind of concentrating on, because I think that if we have a good start in life, we'll have a good finish in life. So we're going to talk about how to enhance the baby's brain. What we have found over the last 20 years, and this is a really hot area of research, is that the brain, as it develops, has a lot of genes that it doesn't use. And it has switches on these genes, can turn them on and can turn them off. We find that the nutrition early in life, even while the child's still inside of the uterus, if the nutrition is poor, it'll turn on some bad genes that when that child grows up will have a high incidence of heart attack and stroke and cancer and degenerative brain diseases. They're turned on very early in life. I told you yesterday about the pesticides. We find that if you're exposed to pesticides very early in life, it seems to program you so that if you're exposed later in life, you'll be hypersensitive to pesticides and can produce some serious neurological diseases. So the programming of genes by nutrition is something we need to pay attention to. We know that the brain develops different than other organs in the body. Most of the organs in the body undergo their growth spurt during the first 2 trimesters of pregnancy. Brain development is during the last trimester and 2 years after birth is when it does most of its growing. It's growing at an enormous rate. All these little connections are taking place. Synapses are connecting, pathways are growing, neurotransmitters are developing. All this is going on at an enormous rate. The brain needs certain things to carry that out. And I told you yesterday at age 4, only 80% of the brain is completed. Age 8, 90%. And it's not fully formed until age 16, but we're constantly restructuring our brains. Now, excitotoxins is one of the scary things that's in the food that children are eating. Infant formulas based on casein hydroxylates regularly consume large quantities of free glutamate. That came out of the FASIP study, which was the most intensive study of the toxic effects of MSG. It was supposed to be the definitive study. It was ordered by the FDA. This study, if you read the bulk of the scientific report, reads just exactly like my book. And a lot of it, I can tell, was copied from my book. But the executive summary written by the FDA, you would never know what was in the report, because they said the report shows that there's no danger to taking MSG. And that's what you heard on television, because news reporters can't read it. They don't know what it says. But it is not what the report says. The report says that MSG is of significant danger, particularly to certain people developing babies, and this was taken directly out of the report, that infants are consuming large quantities of free glutamate and that it does affect brain development. Continuous lies from the media. Breastfeeding DHA, 8 separate studies on breastfed babies versus formula-fed babies shown that the breastfed score consistently higher on intelligence tests later in life. We know that mother's milk contains 30 times higher concentrations of DHA than does cow's milk. There is 0 DHA in formula that does not come from cow. 0. This is the only country in the entire world that makes formula that does not put DHA in the formula. Yet we know it is absolutely essential to brain formation. Americans' breast milk contains 1/3 less DHA than Japanese breast milk. That's because the Japanese eat more fish. They have less of those nasty bad fats, so their breast milk has higher concentrations of DHA. We know that if a woman has, say, 3 children, the first child gets the highest DHA content. The second child gets a little less. The third child gets significantly less. So it progressively decreases with the more children she has unless she's taking in a lot of DHA. And I encourage pregnant women to supplement with DHA, and it is being encouraged from the literature that we're now seeing is saying women need to supplement with DHA, not just while they're pregnant, but all through breastfeeding as well. 70% of Americans were found to give their infants formula by age 3 months. Now, just to give you an idea how important DHA is, it is associated with the fetal alcohol syndrome. When mothers drink and their babies come out severely neurologically impaired. They found that if they fed the mother's DHA, it inhibited the loss of DHA in the baby's brain and prevented a lot of these damage. In a study of 526 adult Dutch children, they compared the breastfed ones to the formula-fed ones. They found that if they were formula-fed without DHA, and they checked them at age 9, the ones that were formula-fed had 200% increase in neurological disorders. That's how much this impacts on brain function later in life. Children who have PKU, that is the phenylketonuria I talked about, where their phenylalanine level is too high, causes brain malformations. When they measured their DHA levels, they found they were a third lower than normal babies. So that may be one of the toxic effects of PKU. When you feed safflower oil to animals rather than a normal oil like omega-3 oils, we find that the brain levels of DHA are cut in half. So eating these bad fats decreases the brain levels of the fats that are needed for normal formation of brain. We find that low DHA levels geographically are associated with high incidence of multiple sclerosis, and we find the high incidence of Alzheimer's disease also associated with it. Yesterday you talked about Eskimos have high osteoporosis because of the fat. I would contend it's not the fat, it's the fact that they don't eat many fruits and vegetables. A recent report from the American Journal of Clinical Nutrition showed the #1 way to prevent osteoporosis is a high intake of fruits and vegetables. Taking calcium, taking all these other things did not affect it. It was intake of fruits and vegetables. So it buffers the blood. Now, also, people who live in Alaska and in the countries that consume a lot of fish, a lot of DHA oils, have almost no incidence of multiple sclerosis. They don't know what rheumatoid arthritis is. They don't get lupus. They don't get Hashimoto's thyroiditis. They don't get any of the autoimmune diseases. But if they move to the United States, or they assume a Western diet, they get lupus, they get rheumatoid arthritis, and they get all these other diseases. So we know it is closely correlated to the intake of this DHA. And I'm getting nasty signs, so I better quit. That's just where you're going to end up at the old pharmacist's place if you don't do what I'm telling you. And if that doesn't scare you, you'll end up seeing me or some other neurosurgeon, and he's going to have to whittle on your brain. And then you'll end up seeing Nurse Helga, and you don't want to see her. So I'll stop there, and I thank y'all.